Okay, this morning we'll be talking about the Mama Natalie Birthing Simulator. We have limited resources this morning, so we're going to have to improvise in our demonstration. This unit here was developed for initially third world countries and areas with very low survivability and birthing rates. Very ingenious in its layout. We have a baby here with a fontanelle, fully functional fontanelle, that can also be filled with water and air. We've already done that to save a little bit of time today. We also have it capable of attaching through an umbilicus all the way to the placenta. Very simple in its operation for loading. This would be worn by an individual, male or female. We're simply going to load the system by placing the baby in the birth canal. We also have a Velcro closure here in which we will attach this kind of to the placental wall area. Once we have our baby loaded in place, we also have the ability to put fluid into this system. Due to the messy content of that, we will not be utilizing that component for this demonstration. This would be worn as such on the individual. You would also have appropriate draping, as well as your appropriate resuscitation tools, which we will go through in more detail. We would drape, we would have on our gloves, we'd be gloved for this procedure. The other nice thing about this, the person that is giving birth would have both of their hands on the inside. This would allow them to be able to control the rate of the birth. We could have crowning. We could also simulate a breech delivery as well as a prolapsed cord. Upon the full insertion and delivery of the child, we're able to palpate the fontanelle. As the mother continues to push, we would then get a head exposure. This would allow us the capability to take our suction device and clear the airway of the child. Very realistic in that process. We would continue further with the delivery. Supporting the mother throughout the process. Upon completion of the delivery, we now have the child. We'll attempt to warm and stimulate the child. Get the child warm and dry. We would then wait for the delivery of the placenta. We would not tug or pull upon the placental cord. Once we have delivery of the placenta, we're going to check to make sure it's intact, that the placenta is complete. Since we are simulating a third world country or maybe an area where things might not be as readily available, we would utilize a shoelace process in order to clamp that cord. And we could then clip our cord. We'd tie one to the placenta. We'd also tie one to the child itself, wanting to make sure we leave enough area for venous structure in case we needed to do advanced procedures. We would then warm the child. Heat loss is a huge problem with children, so we would want to make sure we get this child's head covered and go through the appropriate assessments of doing an APGAR score. We would also have available to us Progentin, any of our other medications that may need. We can still continue to clean the child's airway, and we even have an older model auscultation device to be able to listen to the child's heart rate and breath sounds. We would continue to warm the child. We also have the ability to see if the child is breathing and to measure a respiratory rate. We also have the ability with this handheld control here to simulate the pulse in the umbilicus, therefore checking an appropriate heart rate, an appropriate respiratory rate, and we could effectively provide a good APGAR scoring component for this child. Very innovative, very cost-effective, portable. So far we've had multiple agencies look into this, especially pre-hospital education components that are currently looking at multiples for their education. This concludes the presentation and video of the Mama Natalie. I am not a professional actor, but I was paid by Laerdal to produce this video. Thank you.